Okay, good afternoon, everyone, and welcome. Manitoba Start is the leading provider of career services to newcomers in the province of Manitoba and connects businesses to a world-class workforce. I would like to welcome you all to this Spotlight webinar, a series of live broadcasted events designed to assist you in entering the Manitoba labor market. Manitoba Start acknowledges that we are gathered on Treaty 1 territory, the traditional lands of the Anishinaabe, Anishinaabe, Dakota Oyate, Denisulini, Nihiltok nations, and the homeland of the Red River Métis. We acknowledge that our water is sourced from Shoal Lake 40 First Nation. As a newcomer serving organization, we commit to learning about the histories, cultures, and the rights of the Indigenous communities to strive to build a respectful and supportive relationship for all. My name is Luna. I'm the outreach coordinator here at Manitoba Start, and I will be your host for today's webinar. Just gonna let people in. Our today's webinar is with the Immigrant Services Association of Nova Scotia on National Healthcare Language Programs. Given the large number of participants who have joined this webinar, we have muted your microphone to allow better clarity and less interference. So before we begin, I will be going through a couple of housekeeping items. You can use the raise hand feature to indicate that you have a question or comment because we have a Q&A session after this presentation. So to do this, you can click on the participants button in the meeting control and find the raise hand icon next to your name and click on it, and this will notify us we have a raised hand. And after you do that, I'm gonna allow your mic and you have to unmute yourself manually. And Teams webinar provide a Q&A feature that allows attendee to ask questions. So if you can use the Q&A. So to access this, click on the more options 3 dots button in the meeting control and select Q&A. And then you can type your question in the Q&A panel and feel free to use the chat as well. Before I introduce our today's presenter for today, I would like to run a few polls just to know you more better. So I will just go with the first poll. So our first poll for today is asking, are you registered with Manitoba Start? So you can click on yes or no and then submit your results. You can see some replies on the chat. Thank you. Thank you. Thank you, everyone. Thank you for being Manitoba Star clients. And for those of you who are still not yet Manitoba Star clients, we will share more information on how we can help you and how you can be registered with us. We'll go to the next poll. And our second poll is asking, do you need help with your resume, cover letter, or interview prep? You can again click on yes or no and then submit your answer. I'm going to give you a moment to answer. Okay, thank you everyone who participates in the poll. We do have 71% who their responses is yes and 29% no. So thank you. And for those of you who are required the employment services, Manitoba Start is here for you. So please feel free to contact your career coach if you are already registered, or if not, then you can register online or on our website or contact us. Okay, let's go to our third poll. Okay, our third poll for today is asking your location. Where are you joining us from today? Northern Manitoba, Southern Manitoba, Winnipeg, or you're outside of Canada? Okay, I'm closing the poll now. Okay, we have 83% attending from Winnipeg and 8% from outside of Canada. Thank you everyone for joining us and welcome to today's webinar. Okay, we're going now to our last poll. And our last poll for today is asking, what's your reason for attending this webinar? Are you an internationally educated professional, a settlement worker, a career coach, or other? Okay, now I'm closing the polls. I see some internationally educated professionals. Yes, 90%, 94% of our attendees are internationally educated professionals, and we have 6% settlement workers. Thank you, everyone, and thank you for participating in the polls. We have quite a few attendees. I'm just admitting some people. Okay, so our today's webinar is focusing on the National Healthcare Language Programs at ISANS. The National Healthcare Language Program, NHLP, supports internationally educated healthcare professionals across Canada in developing the communication skills needed to succeed in their fields and exams. Courses focus on patient interactions and include profession-specific language taxes tailored to various healthcare roles. So our today's information session will cover an overview of the National Healthcare Language Program, the eligibility requirements, and a brief introduction to the courses available. And we will have a Q&A session with the representative as well. So please help me welcome Caroline and Rebecca from the Immigrant Services Association of Nova Scotia. Over to you.
Great, thanks, Luna. I'm Carolyn. I am the program lead for the National Healthcare Language Program. We have I think it's a short presentation to go over the program, and I'll get started with Rebecca.
Okay, thank you. Hi, everyone. I'm Rebecca, and I'm one of the facilitators and developers of the National Healthcare Language Program. I'm here with Carolyn to present you some information. So I'm just going to share my slides with you. Can everyone see those okay? Okay, perfect. So, as I mentioned, we're here to talk about the National Healthcare Language Program. This is a program designed to help internationally educated healthcare professionals, such as yourselves, most of you that are here, improve communication skills within a Canadian healthcare setting. So, our mission is to empower healthcare professionals to thrive in Canada, and we have several goals. So, improve communication skills, maximize practice opportunities, prepare for exams, and bridge cultural gap. So, in terms of eligibility, to be eligible for the program, you must meet one of these criteria. So you must be currently residing in Canada with permanent resident status, an economic PR most recently can join with status issued within the last 6 years. So this is a new rule as of April 1st this year. If you've arrived in Canada as a convention refugee, you're eligible. If you hold a valid work permit with the MOME 23 annotation, if you are a participant in the Atlantic Immigration Program or the Rural Communication Immigration Pilot, or if you are a protected person under Section 95 of the IRPR. If you meet any of these criteria, then you are eligible for the programs. Unfortunately, due to our funding, we don't accept citizens or pre-arrival clients at this time. And as I mentioned, we are a national program. So we've partnered with 4 organizations across the country to deliver the program. Our partners in Ontario are the Catholic Centre for Immigrants and World Skills Employment Centre. In the Prairies, we have Calgary Catholic Immigration Services. And in BC, we have ISS of BC's Language and Career College. ISANS will work with the IAHPs in Atlantic Canada, of course, and all of our partners have expertise in the area of workplace communications and contacts and connections within their regions. So that's been really beneficial for us. So we are able to cover all of Canada except Quebec, and we appreciate the funding from IRCC. So we'd like to thank them for that, for providing that for this program. Okay. Using my, there we go. So here's a quick overview of the general program structure. The classes are all 100% online and sometimes synchronous, so they include online meetings, or sometimes asynchronous. They don't include any online meetings, and this depends on the course. So they're between 5 and anywhere from 5 to 16 weeks long, depending which course, and they're all facilitated by qualified instructors. There are ongoing enrollment. There is ongoing enrollment for clients across the country, and you can access the courses at regular intervals from any location. And there's an official CLB assessment upon completion of a course. So the program, due to the funding from IRCC, the program is free for any eligible clients. So there's no cost to you. So ISANS has been offering sector-specific language training for internationally educated professionals for many years. In fact, one of the first ones that we offered was for healthcare professionals over 20 years ago. And they're all designed to help professionals with the communication and the cultural competency skills they need to effectively do their jobs. And in the programs, everything is set in the context of that sector. So if you're a nurse, it's set in a nursing scenario, and if you're a pharmacist, physician, etc. So it just kind of includes the workplace culture and the expectations that go along with those jobs. So we've recently been able to expand 3 of our healthcare programs to the national level, and these are the communication strategies for patient interactions course. So this one is for pharmacists and physicians. We also were able to expand the strategies for CELBAN courses. So there's several different courses under that umbrella, and the professional communication skills for nurses course. So I'm going to pass it over to Carolyn, and she's going to give you some more details about each of our courses and take you for a little walk through what they look like.
Thanks, Rebecca. That last picture was one of my students, Mariana. She's standing in front of the Dartmouth Hospital in Nova Scotia at her first LPN job. She was very excited. I think she's in a lot of our presentations, actually. Okay, so we're just going to start with the one that's for the physicians and pharmacists. So communication strategies for patient interaction. So it's to help prepare the international medical graduates and the international pharmacy graduates for their OSCE. So for the IMGs, it would be the NAC OSCE, and for the IPGs, it would be the qualifying exam part 2, I think it's called, which is also an OSCE. So it's preparing for the communication competencies that you need to demonstrate in this very expensive and very high stakes exam that I'm sure you know about if you're a physician or a pharmacist. The course is 8 weeks long, and this one is synchronous. So there's 2 classes per week. So they are an hour and a half each, and they're usually either Monday, Wednesday, or Tuesday, Thursday. So, and an hour and a half each. I'm going to actually put the next upcoming courses in the chat so you can get an idea. Because we have instructors across the country, they're at all different times. It just depends who's teaching. So if our Vancouver teacher is teaching or a Halifax teacher is teaching, so it's all the different times. So it might work out well for you, which times are the best. You go to the next one. So strategies for CELBAN it was designed for nurses, so for our internationally educated nurses, and it's to help with the CELBAN exam, or also these are both to prepare for the workplace, ideally. And like Rebecca said, there are several courses in this group, and so one is 5 weeks long and all the way up to 16 weeks long. These do not have any classes, so you're able to do the work whenever you're whenever according to your schedule. But you have to finish in the amount of time. So you have an instructor that helps you, and you have work and assignments that you need to complete each week. And the next one is professional communication skills for nurses. Our nurses actually asked us for a little bit easier course. So this one's a little bit shorter. It's only 8 weeks, a little less homework, and it has a lower language level. So this one's mostly for work. So it's preparing you for work. We had some nurses that were preparing to work or already working and wanted to build their confidence. So we made a shorter course, and this one also does not have classes, but you have an instructor that you're doing homework for, and you're getting feedback on all of your homework. And next slide. So a little more about the one for the pharmacists and physicians. Communication strategies or patient interactions. We have a hard time saying it because we always just say CSPI, but we're trying to say the full thing for you. So again, this one's for the international medical graduates and the international pharmacy graduates. It's to improve your communication skills for the OSCEs. It focuses on patient communication. So either physician and patient or pharmacist and patient, which is what the OSCE is. And it's 8 weeks long with coursework that you do on your own, and then online evening classes, or you can see the schedule there. And it depends on your time zone. And all those times I have there are in your time zone, so they're in Manitoba time. And at the end, you do a practice session with simulated patients. So simulated patients are similar to what you would have on the OSCE. They're trained actors from the University of Toronto or the University of Calgary, and you get to do cases with the patients as you would in the OSCE. But they're only communication, so you're only practicing communication, not clinical. You can focus on what you're learning in the course. You need a minimum Canadian language benchmark of CLB6. So this is a free assessment that you can take, and you need to score high enough so you'll be able to participate in in the course. We'd actually accept a 5 in writing because there's not any writing in the course. It's mostly listening and speaking and a lot of reading. So that's why we ask for 6s. But if you're higher, you're welcome to attend. We have people with 6, 7, 8 join the class. Okay, next slide. This is just a run through of the topics that are covered, and it really is focused on the competencies, the communication competencies for the exam. So it's from walking in and introducing yourself to the patient, then asking all the history questions, making sure you understand the patient and the patient understands you. So that might be clarifying or paraphrasing or repeating what you're saying or just making sure everyone understands each other. Showing empathy in the way that's expected in the exam and the way that really patients in Canada usually expect you to show empathy, or one of the ways. Offering advice. You have to give recommendations. You can't tell us what to do as a patient. So I know that you'll probably want to tell us what to do, but in Canada, you have to recommend and the patient has to agree. Ethics and patient recovery, which is a really interesting topic because ethics can be different in each country. We find differences, but it's very important in the exam. It's very, very important. Breaking bad news is for the physicians. So that's a very difficult one. We go through that. The pharmacists don't have that on their OSCE. So we give them another lesson, which is more on skimming and scanning references because you have to read references in the OSCE, and also writing a summary of an article, because that's another thing that you have to do in the pharmacy OSCE. And then everyone else does for dealing with angry patients. So it's the same skills of an angry patient, an upset patient, someone who's very frustrated. So just techniques on how to talk to the patients and how to help them reduce their anger so you can have the interaction and they will listen to you. We give a lot of suggestions, like I think a 5-step approach for the empathetic approach. We also give some phrases and some words that you can use to help deal with an angry patient. It's challenging, but it's doable. The next one. So this is the communication practice session. You'll see the acronym there. So CSPI, Communication Strategies for Patient Interactions. So at the end, we have a communication practice session, and that's where I was telling you we had simulated patients with multiple cases for both the pharmacists and the physicians. And we record the interaction and we give you your recording just for your own viewing if you want to listen to how it went and watch and listen to the simulated patient. Because after you have the interaction with the simulated patient, then you get feedback and you can ask them questions. They'll tell you how they felt, anything they thought you did well, or anything they maybe communication that was uncomfortable. So it really helps you improve and practice. And at the end, we get together. It's usually a group of 8 students, and we get together and we have a debrief session. So we talk about the cases, we talk about what went well, and maybe what we need to work on. So it's a really valuable learning experience because you get to practice all of the skills you learned in class. Okay, next one. So next one's for nurses. Strategies for CELBAN. So this is to help prepare you for a language proficiency exam called the Canadian English Language Benchmark Assessment for Nurses. I always think I'm going to forget. So they're longer courses because they're teaching you how to pass the CELBAN exam and also to improve your language skills. So it just takes a lot of practice doing that. But we've divided into several courses based on listening, speaking, reading, and writing, which is like any language proficiency exam. And you can choose what you want to do. Maybe your reading is excellent and you want to work on your listening. So you could just choose listening, or you can choose all 4. I had a student who took 3 at one time, and I think that was a lot. But we do have students that take 2 at one time. The next slide. So here it is again. We have listening, speaking, reading, and writing. For listening, speaking, and reading, you need a CLB 7 or higher. It's a little more difficult. And for writing, you need a CLB 6. It's because of the scores that you need to get on the CELBAN. We had to make sure we're getting everybody to the right level. The listening course is 16 weeks. It's long, but people are definitely getting higher scores after. So they come in with a 7 and they're consistently leaving with an 8 or 9. So that's quite effective. If you're doing the work, there's lots of videos and audios and timed quizzes and lots of practice and lots of techniques that you can try. Speaking, we just broke into 2 different modules because it was also 16 weeks long. So now we have discussions. Module 1 is discussion skills for 5 weeks, and module 2 is role play skills for 11 weeks. So again, based on the cell band is broken up into the same division, part A, part B. And you can choose to do 1 or 2, and you can choose them in any order that you want. So if you just want to work on discussion skills, you can do that. Reading is 10 weeks long, and writing is 10 weeks long. Writing is very popular. What I'd like to say about this is we had a lot of our doctors and pharmacists ask if they could join this because it's healthcare specific language skills. So we have allowed the doctors and pharmacists to take this course. A lot of the doctors were taking writing to help them with their IELTS writing, but now people are also interested in taking the OET language proficiency exam, and it's very similar to the CELBAN. So this was a way to help students prepare. I think someone has a question, or somebody has their hand up.
Do you want to reply to that now, Caroline? Yeah, I can admit them if that's okay.
Do we have time?
I mean, yes. Do you
Okay,
want
well,
them
maybe I'll
to
wait
be
because
at
I
the
see
end
more
of
hands
this?
going up. So
Yes.
I think
Yeah.
we'll get waylaid.
We'll
I
give them
forget
a
how big
chance
the
by
group
the
is.
end. Yeah.
Okay, we'll finish soon. The next slide. So the last course that I'm going to talk about for this group is Professional Communication Skills for Nurses, PCSN is what we call it. So this one's more based on the workplace. It's not about doing an exam. So it's an easier version of the CELBAN course. You only need a CLB 6 for this. And again, it focuses on patient-centered communication, but we had some nurses that were getting jobs quite quickly, they're licensed quickly, but still not feeling confident in the workplace. So sometimes they're just preparing for the workplace or they're already in the workplace. Canadians use different words and speak very fast. So you might have great English, but this is focused on communication skills. So how people are communicating in a healthcare environment. It's shorter because a nurse has asked us for a shorter course. So it's 8 weeks long, 4 to 6 hours per week. The CELBAN course would be, I think it's 6 to 8 hours per week. And the course for the pharmacists and physicians is about 8 to 10 hours per week because you have those synchronous classes. Can you go to the next slide? Similar to the course for the physicians and pharmacists, it's starting from introducing yourself to the patient, taking their patient histories, using the questions that they recognize and they're comfortable with, understanding the patients. You have to understand them. They have to understand you. Showing empathy, instructions and advice, educating the patient. So that's a big one for nurses, I think. And ending the patient interaction. So that means, how do you leave? Because you're very busy, you have to have a way to close the conversation and move to the next patient. And we also added exchanging and sharing information with other nurses, with coworkers, such as doctors, or on a healthcare team. So how nurses have to give information all the time and share with other healthcare workers. So we've added that as well. I think that's the end of the courses, Rebecca.
Yes.
So I'm going to pass it back to Rebecca.
Thanks. So when we, in addition to adapting our simulation sessions that we used to do in person to an online format that can be done nationally, we decided to also redesign our nursing courses to be asynchronous, so without meetings, so that nurses with busy shift work schedules could do the work at any time. So that also meant that we needed to replace the in-class role plays and the practice to an online format. So we decided to incorporate AI virtual patients to make our courses more accessible and inclusive. So we partnered with a Canadian company called CyberPatient to do this, which is a virtual teaching hospital with over 130 diverse patients, helping students build the real-world clinical skills through guided and self-directed case-based learning. So it offers a safe space to move from kind of theory to practice, and they're developing those clinical reasoning and communication skills. So with the first virtual patients, students work with in the programs, the system prompts the student to select appropriate questions in a structured format to gather information about their complaint. So you'll see on the screen, you'll have your picture of your patient, and then on the left-hand side, you'll see it's kind of divided into categories. So patient information, their chief complaint, their history, that kind of thing. So once you click on that, it gives you a selection of questions that you can choose from. And then you can kind of use kind of priority and clinical reasoning to choose the one that you think is the best question to ask in this case to get the best information from the patient. So we use the structured version first as practice activities to scaffold into the next free form version that are in the assignments. So even though there are over 150 questions available, you need to choose carefully. So this is kind of limited to selecting only 30 questions. So you have to make sure that you're choosing the most relevant question for their complaint. So this is one of the tricky parts of this one, but it's been really beneficial for the clients that have used it so far. So they really like it. So once you finish that version, you'll get immediate feedback on the Cyber Patient platform, and it kind of breaks it down into kind of, your knowledge score, how much time you spent with the patient, what kind of questions you asked, and they color code the questions for you. So the relevant questions are in green, and then irrelevant questions are in red. So you can kind of go back and look at what you've asked and how you've asked it and get an idea of how you did. And then based on that, you have the option to go back and do it again. So it again creates that safe space. So you're kind of able to kind of practice over and over again. So if you see that you've asked a couple irrelevant questions, then you can kind of take that feedback and go back and try again and try and avoid those questions. And then the next type of virtual patients that they use after they've practiced with the click-through structured option, they move into interacting with a virtual patient in a free-form conversation. So it looks very similar to the last one, the picture of your patients on the right. And then on the left, you'll see that it doesn't have any categories, so it's just a blank page. So this, and you'll also notice there's a speak icon down at the bottom left. So in this case, the students are allowed to speak directly to the virtual patient. So you're using your own question formations and your own language that you've practiced in the course. And this one is very supportive of language development because it's exposing you to both the written and the spoken example. So when you speak to your patient, the patient speaks back to you, but your transcript is also happening in real time on the left. So the questions that you ask get recorded in a written format, and then the patient's response also gets written as they're speaking. So even if you didn't quite catch what they said, you have the written form on the left to kind of check and make sure you've heard them correctly. But you can also say, sorry, could you repeat that again? And they will also repeat it. So you get kind of both options. So this builds confidence and it's helping give that practice for meaningful interactions in a supportive setting. So again, that safe option to make mistakes so that you can make them and get feedback and then benefit from them and do better the next time so that you're ready for your exam. So again, you get immediate feedback on the platform. It looks a little different this time. So as I mentioned, it's transcribing as you talk to the virtual patient in the second version. And so you'll get that transcript and you'll be able to read through how you worded questions, what your grammar looked like, that kind of thing. And then it breaks it down into kind of how you did on the right side. So it gives you the positives, what you did well, and then they give you areas for improvement. And this one is also, you also have the option of doing again. And then on your last attempt, that'll be your actual submission for the assignment. And with that submission, then your instructor has the opportunity to go in, look at the feedback you got from the platform, and then fill in any gaps of feedback they would like to give you based on what you've been working on in that unit of the course. So you kind of get extra feedback for those. So This is an opportunity to register for anybody who's eligible. You can register online with the National Healthcare Language Program link that's, I think, Carolyn, did you put that in the chat at the beginning? Yes, I think so. Or if, and you can do that on your own, or you can go through Manitoba Start, or you can contact our program assistant, Olga, at healthcare language at isans.ca. If you're not quite sure about anything in the process for registration, she's really great at helping you kind of figure out if you're eligible and what documents she needs from you and that kind of thing. So she's really great that way if you opt to go that option. So I think we left time for questions. So if you do, that would be great. I think Luna, we have a time for Q&A. Yeah.
Yes, we do. Thank you very much, Caroline and Rebecca, for that very informative presentation. Yes, and we will now open it up for the audience. We do have, let's see if we still have the raised hands.
I've been answering a lot of questions.
Yes.
It's fantastic.
I've seen that.
I don't know if I can type
really
fast
great.
enough, so maybe talking will be easier.
Yeah. Okay, yeah, we have raised hands. Let me just allow the mic for them.
I love how engaged this group is. This is great. Sometimes we get more
Yuanti,
questions.
I have allowed your mic. Please unmute yourself from your side and ask your question. So for everyone who has raised your hands, once I allowed your mic, you have to unmute yourself. Okay, we can try with Mohammed, and I'm gonna give you another chance, Yuanti. Okay, let's try Mohammed. Mohammed, if you can hear us, yes, you can speak.
My mic is now it's on. I want to ask a question about the end of this courses. You will give us a certificate or not?
Yes. So at the end of the course, thank you. I forgot to mention that. So at the end of the course, you will get a certificate. For the CELBAN courses, if they're the speaking, you'd have to do both parts to get the speaking certificate. And also at the end of the course, you do another CLB assessment, but it's healthcare. And it's actually an iCELBAN. It's like the CELBAN exam. So it's practice doing a language proficiency exam. And you have a chance to get a higher score. So sometimes people come in with a CLB 6 and they might leave with a 7 or an 8 because you're learning, and also it's healthcare and you know healthcare so well, it becomes a little bit easier to do because you're a professional.
Yeah, it's okay. But my question is have two parts. We get the professional on the healthcare certificate or the English certificate?
So you will get a certificate saying you finished the course. And then you'll also get official CLBs that will go into the government system. So if your scores go up, maybe you want to take a different course and you can get higher scores. But it's also practice doing a language proficiency exam. Does that answer your question?
Okay, thanks. Thank you.
You're welcome.
Thank you, Caroline. Thank you, Mohammed, for your participation. And I guess I'm not sure if Caroline, you have answered this, but Yuanti has written their question here. The CLB6 is the requirement for internationally medical graduate, also for enrolling this program.
Yes, so the physician and pharmacist course, communication strategies for patient interaction, you need a CLB 6. So that's 6 in listening, speaking, reading, and writing. But I put in the text, you could have a 5 in writing. Writing's difficult. So, but basically a CLB 6.
Perfect. Kawaldeep, I have allowed your mic. Please unmute
Hi
yourself.
there.
Yeah. Hello.
Yes, so for the CLB6, like, do you accept IELTS certificates
We always get
for the
this
assessment?
question, and I wish I could say yes, but we can only
Okay,
accept the Canadian language benchmark because of our
which is
funder.
Mhm.
So
okay, okay,
it's a good question. I'm glad you asked because I didn't really say that.
okay.
You can get a free assessment in many different places. I'm
Yes,
sure Manitoba Start can help you.
yes,
And it
I
doesn't
booked
take very
appointment
long.
with them.
Pardon?
Yeah, yes, I booked appointment with them. I'm going to take a test on 11th May. So my next question is, it's
Great.
about the cell ban. Do we, once we finish the course, do we get the certificate just like when we're doing the IELTS exam? And after that, we get the result report, and then we show that. For example, I'm already started my registration with CRNM in Manitoba. My all the process is done. It's just I'm stuck at the writing for the language requirement. And so that I was trying to do it through the IELTS, but I'm not able to achieve 6.5 in IELTS. I'm stuck at 6. So that's why I'm choosing CELBAN now. So
Okay.
you are going to give the all the practice material and the classes at the same time. But my question is, do we get the certificate which is acceptable by these organizations? For example, CRM NM in Manitoba.
No, so it's not an official cell band score. That's a really good
Okay.
question. It's an official CLB score, but what it would do would prepare you for taking the cell band.
The exam. Yeah, okay. Perfect. Because I have zero knowledge about Salban because I've never studied this before. I
Okay.
do know I was trying to meet the requirement through the IELTS, but I gave the exam a couple times, but I just stuck with writing.
A
So
lot
many,
of
so
people,
many,
yeah,
they get stuck. You get 6,
yeah.
6.5. Yeah. And I don't
Yeah.
know, there's some kind of trick.
A
So
lot of nurses
what's
find it
helpful
easier.
is, oh, sorry, I'm talking at the same time.
That's okay. I was just saying a lot of nurses find the cell ban easier because it's based in their profession. So you're
Yes.
actually doing role plays that make sense and that are based in a nursing situation rather than just some random academic
Yes.
IELTS situation
Something
that
like
you wouldn't
Exactly.
cars
use
or
in.
something.
So my another question is, for example, let's just say if halfway there, if I see myself, because I know my communication skills are also good, because in other modules I've been like I've achieved a 7.5. It's just my writing that I'm not able to get it. But let's just say in the halfway through the halfway, like in the score, I see myself that where I stand and I'm ready to take the test. So am I able to do that, or do I have to, once I started it, or do I have to finish it all the way to the end?
As a former instructor, I'd say yes, you have to finish it, but you don't. I mean, if you get what you need from the course, that's fine. So and
Okay.
also I wanted to tell you the way the cell band courses are set up, they're set up like the cell band. So you start to get an idea of what
Yeah.
this is going to be on the cell band. So for example, the writing for cell band has two parts, and the first part
Okay.
is giving your opinion on a
Yeah.
healthcare question, and the second
Hmm.
part is writing reports. So then you have a
Okay.
little bit better idea of what's expected from you. And we've also just
Yeah.
added three, I think it is three practice timed assessment because some people are having problems writing fast enough and getting that practice. So we have three practices activities and
Okay.
then the ICELBAN simulation writing. So you've got lots of practice and you'll get lots of feedback from your instructor.
Okay. Perfect. Thank you so much.
You're welcome. And your English is great, so I'm sure you'll do great.
Thank you. My English is great in speaking, listening, and reading, but when it comes to writing, oh my God, I can't explain you. Last time I gave, like, usually I get 6 in writing in academics, even in general, but last time when I gave the exam, like, even I was preparing, I was like, oh my God, it was only 5.5. So I was really
I
disappointed in myself.
I would never take an IELTS because I'm a language instructor. I'd be embarrassed if I didn't pass. I'd be humiliated because it's my
It's
profession.
so, like,
So I
IELTS
do.
standard is so high, like it's just I can't meet them.
I think you like the cell band better, from what I
Yeah,
hear.
hopefully. Okay, thank you so much.
Great.
Thank you. Okay, so I'm gonna allow Mary your mic. You can ask your question.
Hi, Caroline and Rebecca. Thank you for your beautiful presentation. My question is, so I did a WELARG. I'm an international educated nurse, and I'm on my way taking the nursing license for RN, and there is a requirement that says that I have to do IELTS or the CELBAN. And the first question is, I only did a WELARG exam. So is it still eligible to take the CELBAN with you? And the second question is the CELBAN that we're taking from you, is it still valid for the license, to get the license, because they require the CELBAN as well?
Okay, I think WELARC is probably doing a CLB assessment, but I'm not sure if it's a Canadian language benchmark assessment, then we'll accept it. Our course is preparing you for the CELBAN, so we're not giving you a CELBAN score. We're helping you prepare to do the CELBAN. So the courses will just get you prepared, and then you actually have to take the CELBAN and pass it.
Oh, okay.
I wish we could do that for you, because we'd be helping you all the way.
Yeah, that would be great. So, am I still eligible to register with you? Because when I write you in the chat, Caroline, you said I need to have my immigration documents as well as my CLB documents.
Yes.
So the Canadian language benchmark, that it's also worked for the WELARG?
I'm not familiar with what WELARG does, but if they're doing a language assessment, I think they're might be doing a CLB, so you'll have to look at the document, or you can just contact Olga. She's kind of the expert on this, and she'll be able to tell you if it's the correct document for a CLB. And the other thing I need to tell you, Olga wanted me to mention this. So a new requirement is if you're sending your PR, you also have to send your COPR, which is a document that's your confirmation of PR, confirmation of permanent residency, because we have to see if your economic status, economics class is less than 6 years. So that's just new. So if you're sending your PR, you want to send your PR card and your confirmation of PR, and then your CLB document as well. But Olga will send all this to you when you contact her with that email address.
Yes, I already did contact her. Okay.
Oh, great.
Thank you so much, Caroline. Yeah.
Wonderful.
Thank you.
Sorry, I'm not answering the text right now because I can't do two things at once.
Yeah, I'm just gonna forward them for you. But meanwhile, we can allow Abrosede, if I'm pronouncing your name correctly. I will allow your mic. Your mic is allowed. You can speak.
Hello, thank you.
Hi.
Yeah, so I just wanted to ask, I'm a physician, all right. I came here with a permanent residence some months back. I've had multiple IELTS done, both the general and the other specific one. And hearing now that it's only the SELP that will be accepted, is that am I right by that submission?
I'm not sure in Manitoba. I'm actually in Nova Scotia. They changed those things a lot. I thought most provinces accepted the academic IELTS, but maybe that's different in Manitoba. I'm not sure.
Okay, I just want to confirm if that is the case. And to get into the program, you said I need a benchmark of about 7 or something.
Right, so that's Canadian language benchmark, so that's a different exam. It's just an assessment, really. It's not an exam. And I'm listening to you. I'm pretty sure you get a 6. And I can't remember what it is in IELTS, but so it's just an assessment that our funder, IRCC, requires. So you just set up a free assessment, you get your 6s or 7s, and then you can join our program.
Okay, so how can I set that up? I'm sorry?
Pardon?
How can I set that up? Sorry to bother you.
That's okay. Olga could probably send you where you could get an assessment, but I'm thinking Manitoba Start might be able to tell you also where you could get a Canadian language benchmark assessment. I'm thinking that. Yes. Okay, great.
Yes.
Okay.
You can
All right,
contact your career coach or the front desk.
So I think that would be best because they give you the list of every place in Manitoba that does free assessments.
Thank you.
You're welcome.
Thank you so much. So we'll go now a little bit on the chat and then try to answer those questions. So Reza is asking if I have a medical education in Ukraine and I'm in Canada under the Kuwait program with an open work permit. What are my steps to start a nursing career here in Manitoba?
Well, we're not able to accept you in our program. We were for a year or two, but we're not currently able to accept the C8 permit. So I think you'd have to contact, I think maybe Care for Nurses might be able to help you. I'm not sure if they operate in Manitoba. There's a few other groups that will help. And Red River College, that's in Manitoba, isn't it?
Yes, yes.
Yes, they have some IEN programs as well. I probably shouldn't tell you that, but they're great programs. So I think that might be helpful to you as well.
We will have a session with them as well in June. So if you want to join that, that will be good as well.
They have some amazing programs. I don't know if they have exactly what we have, but they really have some specific IEN programs that would be very helpful.
Yeah. Okay, thank you. And Priscilla is asking, can this cover for our language proficiency requirement if we have the certificate?
No, CLB does not. It's not what the nursing or pharmacist or physician licensure accepts. So you usually have to do something like the CELBAN or an IELTS. The CLB is really just for language schools. It's an IRCC requirement, immigration, refugee, something, and citizenship. I can't remember, IRCC, they're up under. So you would still have to do a language proficiency exam. We can help you prepare for a language proficiency exam, but we don't give the exam.
Okay, and they have a follow-up question as well. I'm interested in CLBAN course, but my scores are 6, 6, 6, and 5. Is a minimum score of 7 required?
Yes, but there's a way around that. So if you're an IEN, internationally educated nurse, you can take the professional communication skills for nurses course that only requires a 6. And then at the end of that 8-week course, which is shorter, you will do an assessment, an ISANS assessment, which gives you the chance to get a new CLB score. So what some nurses are doing, they're taking that course, they're getting their 7s in listening and speaking, and then they can go on and take the some of the CELBAN courses because they get the higher score.
Okay, perfect. So we have another question from Sharjam as well. I gave CLB exam and got average score of 8. So I am eligible. I'm not eligible. Is that the question?
Yeah, 8s are definitely eligible. It's just 6 or higher. I do find that people who get 8s are sometimes higher because the assessment only goes to 8s. So we'd love to have you on the course.
Okay, so we have another question from Andrea. They are saying I'm a physician, but I'm currently an international student, meaning I don't have a professional license. Can I participate in the course?
They're currently an international student?
Yes.
No, we can't accept international students. Once you've applied for and gotten your COPR, we can accept you.
Okay, sounds good. That's great. Thank you, everyone. And I will allow a mic for Mahaddin. I can see your question on the chat as well, but if you can speak and ask your question, you can do that. If not, we can ask your question.
I just wanted to add one thing that I forgot about. We are working on a new model, a new funding model, and we hope to have it ready in the summer. So we're trying to find a way that we can help the Canadian citizens and the international students and the CU8 clients. We don't have that yet, but it's something we're working on. Because we always feel bad when we say no. It's like our least favorite part when you say Rebecca.
Hi.
Hi, welcome.
Yeah, go ahead, Nadine. Yeah.
Hi, you have just answered my question. I am asking if I am Canadian citizen, how can I apply for this program for pharmacist, please? And
Yes,
with
so
accessibility in Winnipeg?
yes, so right now we don't accept Canadians, but they are working on a new model. So it's something that we could probably communicate with you through Olga. Like if you contact Olga, she'll put you on a list. Or we can let Manitoba Start know when we have this new funding model.
And there is possibility for this new program that you are planning to do for Canadian citizens?
I'm hopeful. They're trying to do something different with my ISANS where we work. They're trying a new way to help other people take the courses. But right now, IRCC will not fund Canadian citizens or international students. I'm also trying to find other funding, but it's quite difficult right now.
Okay, thank you.
Okay, thank you so much. I will go one question on the chat. I have a question regarding CLB 6 requirement for international medical graduate, IMG. I wonder whether my medium of instruction certificate from my educational institute is to meet the requirement of CLB 6 to get admission into this program, since my medium of instruction is English in my previous study as IMG.
Yeah, I wish, but because of our funder, IRCC, we have to have CLBs. Everyone who takes the courses has to have a CLB. It's not a difficult assessment. You'll obviously do great, but you have to have that document with your CLB scores. And it's a free assessment.
Yeah.
So it's just time
Perfect.
consuming.
Thank you. And we have Priya. I have allowed your mic. You can ask your question.
Hello. Hello, can you hear me?
Yes.
Yeah, we can hear you.
Yeah, I just want to ask about the CELBAN. As I'm a physician, internationally graduate physician, I will give OET. So how CELBAN will help me in preparing OET and the writing, reading, and listening. These are all different courses, or it's a one course?
So they're all different. You can decide which ones you'd like to take. Some people take one and some people take all four. CELBAN is similar to the nursing OET. So it's not exactly like the physician OET, but we have physicians who take it to help them with the OET because we do things like role plays and discussions. So for example, if you took the speaking for CELBAN, it's easily to change the discussions to doctor. So it might be why did you start your profession as a doctor instead of nurse? And then you get feedback from your instructor on either speaker you're writing, whatever course you're taking. So it is helpful, especially the listening. It just gives you a feeling of doing a listening proficiency test online as well.
Okay, and I'm sorry, go ahead.
I don't know of OET specific courses. I mean, there might be in Manitoba, but I don't know. If you wanted to take this, it will help you. And it's healthcare based. So
Okay, and I want to ask one more question that I took some courses from RRC and where I assessed CLB. So I have to give again assessment, or it's a
no, I believe, yeah, I think we accept the CLBs from RRC. So you could send that document.
And so one more last question. Do you offer in person any session to practice neck courses, neck OSCE in person?
Not in person because we're in Nova Scotia, but we do for the doctors and pharmacists, the communication strategy for patient interaction is to prepare for the NAC OSCE, but it's the communication skills for the NAC OSCE. So in every class, you practice cases with the other students and you get feedback, and every assignment is a case where you get feedback. And then at the end, you do a session with simulated patient where you get feedback. So it's not in person, but you're doing the practice all the time.
Oh, okay. Thank you.
You're welcome.
Okay, thank you so much. We'll go to our last question for today. I'm gonna allow your mic, Oma.
All right. Good afternoon, all. Can I be heard? Can I be heard?
Yeah. Yes.
Yeah,
I can hear
yeah.
you.
We can hear you. Yeah.
All right. I am an IMG and currently on the pathway to licensure, taking my exams. I have booked to take CELPIP later in the year. So I don't know how soon. I don't know if I'm eligible to this program, a permanent resident, and how soon I can start up with the, training and the classes in preparation for my CELPIP next month.
Okay, so you'll need to do a CLB assessment, and you need to send your immigration documents to Olga and your CLB assessment to Olga and your COPR if you're a CO permanent resident. And once Olga has those documents, she can put you in a class. So the IEN classes start every Monday, and the IMG classes, I put in the dates in the chat if you want to scroll up. The next one is on Monday. So if you could get all your documents into Olga and she can check them by Monday or Tuesday, Tuesday's probably fine. You can start that class, but you need the CLB document and you need your immigration documents.
Now, by CLB documents, may I be cleared on that?
Mm-hmm. So that's the Canadian Language Benchmark Assessment, and it's a Canadian language assessment, and we require that to take any of our courses. If you really wanted to take the May course and you had an appointment to do the CLB assessment in the next week or two, we could accept you if your IELTS score was high enough, but you still need to have the CLB score.
Well, the IELTS I used for my immigration process, it's expired, but will it still serve?
As long as you're getting the CLB assessment. So that's the if you don't have that, we can't keep you in the course. So if you could contact Manitoba Start and get an appointment for a CLB assessment, and then tell Olga, oh, I have an appointment next week. Here's the document showing my appointment next week. Then if we have space in the class, we can tell you. There's 3 spaces left in the May 4th class, and the other classes are all open. I'm also the person you'd talk to get me to make more classes. We have that capability. So if another class fills up, if we have 2 classes in June, they're completely open. So
talking about the COPR, I already registered with Manitoba Start, right? They already gave my COPR and every other document I was requested of before registration. So I don't know if the Olga you're talking about is a different person, different office. I don't.
Yeah,
Right,
that is a challenge. I wish we could all use the same system that had the same documents, but we're actually a different association, so you'd have to send your documents to ISANS, and our person who works here is Olga. So it's different than Manitoba Start, and it's different than any of the licensure process.
All right. So how do I get her contact or the contact?
I put it in the chat, but I can put it in again. So it's just healthcare language. Make sure I don't misspell it. At isans.ca.
Oh, okay. Thank you very much.
You're welcome.
Thank you. Thank you.
Hi,
very
Carolyn.
much.
It's just, I'm sorry, guys. It's just one more question. What's the next program after the 4th May? Because I'm going to do WELARC assessment on 11th May.
Okay.
So what are the courses afterwards for the CELBAN?
For the CELBAN, you can start that any Monday.
Okay. Okay, perfect.
Because it's on
so there's no
your own time. Yeah. So you just have to sign up with Olga and then pick once she has your documents, you can pick the Monday that you would like to start.
Okay, perfect. Thank you so much.
You're welcome. And I just put the dates again in for the communication practice for patient interactions, if anyone's interested.
Perfect. Thank you so much, Caroline and Rebecca, for joining us today.
This is
It was
wonderful.
really very interactive session.
Yes, it's great.
Yeah. And thank you everyone for all your participation and your excellent questions. I have put a QR code for a quick survey. At Manitoba Start, we value your feedback, and it's important for us to give us your feedback. In the question, if you scan this QR code, it will ask you the event type. So our event type for today was information session. I'm just gonna put a link as well if you can scan the code.
I just put a link to our video that's on LinkedIn.
Perfect. So thank you for joining us today. So if you are currently not a Manitoba Start client, you can call our phone desk or visit in person. We're located at 271 Portage Avenue, or you can also go to our website and register for our services. By registering with Manitoba Start, you will be connected with settlement services and have access to career services that can assist you with your resume development, career planning, job search strategies, and interview skills. For our list of programs on career services, please check our website. And for events like this, you can also check our website for events. And if you miss any of the events that we have or the webinars, you can check our webinar recordings as well. Don't forget, Manitoba Start is here to assist you by providing services, again, on personalized career coaching, developing your resume, job search assistance. We will help you connect with employers as well. And also find us on social media to stay updated on our latest events. And we do have a very popular newsletter that goes to 35,000 people monthly. So you can subscribe on that on our homepage as well. So on behalf of Caroline and Rebecca from Immigrant Services Association of Nova Scotia and the Manitoba Start team, thank you everyone for attending, and stay well.
Thank
Have
you.
a great day, everyone. Thank you.
Thank you.
Thanks, Luna.
Thank you.